name is Caiti and I work at Counseling and Psychological Services at the University of Central Florida. Today is World Mental Health Awareness Day, and with me I have a counselor from Counseling and Psychological Services, Caiti Bradbury, LMHC. Caiti, do you want to tell us a little bit about yourself?
Sure, yeah. So my name is Caiti Bradbury. I'm a licensed mental health counselor here, and I've been working here about 3 years in different titles. But I work with students that come through, undergraduate, graduate students, but I also work very closely with Asian identified students here in an individual and a group setting.
Okay. So since you work with Asian students, do you want to tell us a little bit about mental health in Asian communities and what that's like?
Yeah, so my experience is that it's pretty stigmatized in the Asian community. Of course, there's differences within each different culture within the Asian community, but for the most part, it's a very collectivistic society, and so typically the value is let's think about the family's needs rather than the individual needs of the family members, and so and emotion, it's not a very emotion focused culture as well, and so typically emotions are viewed as weakness, and so it's not talked about much in those families, and so or in that culture, and so anything related to emotions like emotional distress or suicidal thoughts, anything like that, anxiety, depression, it's not typically going to be something that Asian individuals may feel comfortable expressing to their family, and so and the messages that are told to them growing up, and so that's not really something talked much about. So
okay, what do you guys offer at CAPS to help the Asian communities?
So I of course have my group Empowering Asian Voices that I started in the spring, and so I'm trying to run it every semester, but that's definitely a group that any Asian Asian identified student struggling with any cultural pieces related to, why they're feeling what they're feeling and want to have a space to really talk about the things that are stigmatized typically within their family system, that's a space for them to really address those concerns. And I grew up in a half Asian culture, so I understand the cultural differences that could impact a person, and so that's part of the reason why I created the group. And we've been getting a lot more Asian identified students come through CAPS, and so felt like it was definitely a resource that could be available. That, of course, we have myself and then a few other clinicians here who identify as Asian who could understand that student's problems and their struggles. So, and then there's other campus resources. There's different Asian student organizations that are here at UCF that are available for, that are here. And then I'm sure there's others I just can't think right now at the top of my head.
Okay. What do you think that we can do as a community to help reduce that stigma of mental health?
Definitely talking about mental health and mental health awareness is a great first step, because we are afraid of what we don't know, don't understand, and we don't understand something we don't talk about. And so to talk more about it would help to destigmatize some of the stigmas associated with mental health in general, and for people to kind of recognize that there's no shame in asking for help. As a human being, your emotions are totally valid, and you deserve to talk about those things. And so if people can recognize and encourage friends that they notice that maybe going through something difficult, to ask them to seek help at the resources that are available to them.
Okay, so that's all the time that we have today. Thank you so much for sitting with me, Caiti.